Ever needed to have a total joint replaced? I'm an anesthesia provider, I'm a CRNA, and I do those all the time. Well, at least the anesthesia for it. Let's talk about it. I didn't really get a lunch today, and I found this banana in my car. We're about to eat it. A little squishy. First and foremost, I'm going to meet you out in the preoperative area. It looks something like this, and I'm going to get anesthesia consent from you. I'm going to talk to you about all the things, give you a little heads up of what to expect, and ask about your history and all things, even though I've already looked through your history. But I'm gonna get your point of view. On the way back to the operating room, most likely for most patients, I'm going to give a drug that's called midazolam, also called Versed. It's an anti-anxiety medicine that we give to most people. There's a lot of ifs and that's, like, you know, maybe ifs, whatever, on some people that we can't give it to, but that's a whole nother video. I like to call it the happy juice, or, hey, I'm going to give you some medicine that my jokes are about to get really funny after I give it, and it makes me feel better about myself. This is also the medication that you guys are always like, hey, after this was given, I don't remember everything. Yeah, because it caused retrograde amnesia, most likely. Then, ta-da, we arrive in the operating room, and then we're going to have you scoot over to the procedure table. Even if you don't remember doing it, it was most likely you that did it yourself. It's just the drugs that make you think you did. The most common anesthesia for a total joint surgery is a neuraxial blockade, also known as a spinal block. Similar to what people get for a C-section, but we use a different type of drug that allows for the medication to only go about as high as your belly button. For a C-section, we want the drugs to go up a little bit higher because the incision is in the belly as opposed to just the hip. I'm going to have you sit in something like this, and I'm going to have either another tech or whatever. Ooh, I'm looking really tan. I can also have you laying on your side. Some elderly people have to have it that way, especially if it's a broken hip, and we're doing a spinal blah, 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 blah versus a total joint replacement. It's a sterile procedure. It takes me about 30 seconds to do because I'm good. Okay, just kidding, more like 2 or 3. When I have you sitting like this, unlike what this picture depicts, I do have you hooked up to all of my monitors, sometimes even a little oxygen, depending on how much I need to sedate you for this procedure. Some people are pretty much awake for the spinal procedure. I do numb you up at the skin location first before I place the needle. The needle is super small, way smaller than an epidural needle, and much faster than an epidural placement because we're not threading catheter, most likely. Then we lay you flat on the bed, and I'm going to place an oxygen mask on you or a nasal cannula of oxygen, and I'm going to start what's called a propofol drip on you. Obviously, there's some people that for a total joint replacement do not qualify for a spinal, and I have to do what's called a general anesthetic. This is assuming you're getting a spinal. Hook you up to some oxygen, and then I start propofol. A lot of patients call it, oh, that Michael Jackson drug. Yeah, well, Michael Jackson didn't have me or someone like me. I'm going to titrate this drug to effect to where you are perfectly asleep but still breathing on your own. The mistake with Michael Jackson was he stopped breathing on his own, or possibly he obstructed. Something called capnography, which is something that monitors your end-tidal CO2, so your CO2 gas exchange when you're breathing out. It tells me when you exhale. If you obstruct or you stop breathing on your own, this waveform, this little white one, would disappear. And I would have to turn off the drug or make a drug change or do something or move your head or put an oral